Hey, what's up, guys? Welcome back to the Move Better channel. I am your host, Dr. Joe, and this is the Professor John Penisarata. We are here today to talk about back pain. We're revisiting this, you guys, because there's a lot of things that we could do for back pain. Today is not so much of an acute injury. Today we're going to be going over some aches, some pains that you might be dealing with because you guys might not be mobile enough. You guys might not be moving enough. Today we're going to give you guys some exercises that may be able to help you guys out, bring some awareness to your back, regain control of your back, so that way you guys are not going to be sitting in such an awkward position all day long with pain. So let's get you guys fixed because we got your back. So again, the main focus of today's visit is going to be working on controlling that back. And in controlling the back, we've got to be able to have awareness of it. Sometimes we have a misfiring or a miscommunication between the brain and that area, so we want to gain control of it, and that's what the foam roller or lacrosse ball is going to help us do. Today, we have a softball that we're going to be utilizing to help regain mobilization of that lower back. So first thing we're going to do is we're going to place this on an area that's normally pretty overactive or pretty tight. And so this is the area that we're going to hit it on, right along those QL muscles, a very sensitive spot for a lot of people, and we're just going to lean into it. Now, most people try to roll up and down. That's not what we're trying to do here. We're just trying to gain that awareness. Again, we're leaving it on there just to create like a trigger point response or a self-massage response. And in massage, sometimes you don't have to go up and down. You don't have to roll it all around the place. We could just leave it on a sensitive area and just press onto it. And in his case, he's just leaning down on top of it. He's creating pressure. That feels pretty good, right? And if he wants to, he could just drop, instead of leaning his whole body on it, he could just drop his knee down to the one side. Oh, yeah. And then he could bring his knee back over. And he's not necessarily rotating his spine here. He's just letting the hip do what it needs to do in order to put more pressure into that lower back, because that muscle attaches to the hip. So we want to create motion there as he's communicating that area of the spine. Cool.
Good, feels good.
Next, same idea, same positioning now, and instead of on that QL muscle that we're trying to get on, he's going to try hitting it a little bit lower on the top part of his hip and on his glute med area. So he's going to place that pressure on that ball, and he's going to lean into it. And again, he doesn't have to roll it. He's going to feel some pretty good tension on that already. And he's putting pressure. Notice he's kind of shaking here. We're going to push his knee out, and we're going to bring it right back in again. And this is a really good mobilization or a myofascial release, self-massage, whatever you want to call it, when you're feeling some radiating pain going into the SI joint itself. So this is one of the areas that we want to try to mobilize. Now we're going to put a little bit more pressure by rolling your hip into it, and we're going to bring it right back out. So about 60 to 90 seconds is where you want to be. Again, some people spend lots of time on this. You don't necessarily need to. We're only trying to create that communication pathway. And then the last one that we're going to do is we're going to still use this ball, and we're going to get onto the lat muscle. Now, lower back pain is a combination of things going on. Most of the time we feel the symptoms in our lower back here, but there's more that's going on. It could be coming from the upper back, and it could be coming from the lower back, or from the lower half of your body, which is your hips. It could be coming from your shoulders as well. So we're going to try to get the lat to mobilize as well, or self-massage, and we're going to put it just a little bit higher than that QL. And again, he's just going to rotate his body, his rib cage into it, and then at the same time, you're going to bring your arm up into the air. And as he's bringing his arm up into the air, he's pinning and stretching that lat muscle, and that's creating awareness of that lower back. And again, 60 to 90 seconds is where you want to be. If you want to move your arm up and down, that'll probably be pretty good to help regain control of your back muscles. Yep. Perfect. Awesome. And the last one we're going to do with this lacrosse ball or this softball is we're going to get it even closer to his spine here. Now we're not rolling up and down, we're just creating pressure into those segments, and we don't have to lean our whole body on top of it. We're just putting pressure into it, and then we're coming right back off of it. Putting a little bit of pressure as if somebody's just grabbing their fist or their thumb, putting it into a trigger point area, holding that down. Now remember, this is not for a spasmodic or an acute injury. This is something that's been lingering for quite some time, and this is how we want to regain control of it, okay? That's it. Perfect. And then we're going to bring it up one more time up here, just a little bit higher on that thoracic spine as he's leaning over it and reaching and pressing. And notice he's kind of moving his shoulder around this area so that way all the communication pathways of those muscles of the back will start to get stimulated.
Next thing we want to do is we want to now stretch and mobilize the spine a little bit more, okay? So what we have Dr. Joe here is he's in a quadruped position where your knees are directly underneath your hips and your wrists are directly underneath your shoulders. And we're going to try to get the spine to move and stretch in certain ways, right? So the spine does flexion and extension, all right? So in this position right here, we're going to start from the pelvic region and have him rotate forward anteriorly. And it's going to extend the spine from lower back, mid back, upper back, and then also the neck. Okay, so now he's extending it, all right? In certain cases, some people might feel a stretch in the abdominal region or the front part of the body, all right? How's that feeling, Dr. Joe? Feeling back muscles tightening up too, right? Because you're activating it right here. And then we're going to do a flexion of it. So we're going to posteriorly tilt and then round the back all the way top of the neck head region right there, okay? Nice even stretch, and then repeat the other direction. It's usually called cat-cows. I've heard it called cats and dogs. This is the cat position is when you're rounding, okay? I like to start from the pelvic region and make it like almost like a centipede action. Some people, they just kind of start moving the spine in a certain way, and that's fine too, because at the end of the day, you just want to start moving it. But I like to just go segment it and go from pelvic region, lower back, mid back, upper back, up to the neck. Exhale as you do the cat position, and then inhale as you go the other direction. The cow. The cow. Nice work. So that's one way of mobilizing that spine and getting a good stretch out of it. Then from here, since we're already in the quadruped position, we're going to do a thread the needle. So the thread the needle is going to help with thoracic rotation. He's going to take his right arm, and that's your left, but that's okay. As he's going to take his right arm, he's going to reach underneath across like you're trying to thread a needle through a hole right there. Getting a good stretch on the spinal area. Okay, rotating the region where it needs more mobility. And then he's going to come around and he's going to reach up to the ceiling. Try to get a good straight arm if you can from the one hand to the other. If it's limited, that's okay. But remember to mobilize the thoracic region and not just the chest and shoulders. A lot of people focus too much on the chest. Okay, but that's also working and stretching out. But you want to focus on getting rotation on the trunk. Okay, you do one side, you got to do the other. Good. If you're doing more of a stretch static, you could hold each position 30 seconds or so. We like to kind of mobilize it and move across the range of motion and do a few repetitions here. And you'll notice every repetition that Dr. Joe is doing is slow and controlled. He'll hold the end regions or their end ranges for a few seconds and then go back to the other direction and focus on improving that range. There you go. Looking good. All right. So another exercise that we can do from a quadruped position that will help with the thoracic and lower back area is called the bird dog. Okay, some of the people that may do a lot of yoga are familiar with this, but you don't have to do yoga necessarily, but this is a good exercise to help with trunk stabilization and activation. Okay, so again, quadruped position, you have your knees directly underneath your hips, wrists directly underneath the shoulders. What you want to do is you want to get your spine into a neutral position, all right? So not overly curved, not overly arched, somewhere in the middle where you feel like, okay, that's about a good natural position for you. Okay, you got the lower curve and the upper part of your curve in your spinal region right there. And what you want to do is also go ahead and feel like the muscles of your trunk is activated, okay? Different ways to do it. You could pull it in, or sometimes you could push it out. All depends on how you want to feel like you're supporting the spinal region, okay? From here, you're going to take one leg and the opposite arm and extend it away from center, okay? So Dr. Joe is going to take his right arm and his left leg, extend it away from center. And as you're doing that, you're going to feel stability work in the spine and the back area. and as well as the opposite shoulder and hip, okay? And your purpose here is to really elongate the spine, okay? You saw him do this little hyperextension. That's not what you're trying to do. Keep that neutral spine and then try to elongate yourself. Use the hands and the leg to pull yourself apart and create a tracking movement here. And then bring it back down.
Rotate as well.
Exactly. Try not to rotate the hip. Don't rotate the upper body, right? You see a lot of people do that. That's all overcompensation. So that's why in these exercises, this exercise right here in particular, slow movements is what's recommended so you can really have a better control of your body, okay? You do one side, and obviously you want to do the opposite side as well, okay? If you have the flexibility, I would try to get that arm to maybe even line up to the side of your head. If you don't, that's okay. Go as far as you can go. Okay, Dr. Joe got that flexibility in the shoulder, pretty good there. Okay, and then bring it back down. Again, focus is extending yourself out, elongating the spine, creating that tracking motion of the spine. Don't over hyperextend your lower back, and really create that fluid motion. Feel the balance work that's being created right here.
What we got next here is the main thing is we're trying to control our back muscles. We're not trying to overly move it right now. We're trying to create some stabilization, and we're going to try to get what we call the McGill curl up, okay? In this position, what we're going to do is we're going to bring your hands underneath his lower back here, both sides. And the reason for that, all the way underneath your lower back, not underneath your hips, not underneath your tailbone. We're going to bring it underneath the lumbar spine here, right? Between the rib cage and our hips. And the reason why we want to do that is because we want to make sure that we do not create pressure onto our hands. We're trying to maintain that neutral spine or that neutral lumbar spine in this position here. Next thing we're going to do is we're going to drop this one of the legs straight out, and we're going to keep this heel in nice and tight, okay? So his foot straight up into the air. No, keep your foot down. Your foot is going to be straight up into the air. Rotate your hip in. There you go, keeping that knee nice and locked here. And then from here, we're going to try to create a curl up without necessarily pressing into our lower back. Most crunches, people press into their lower back and their lower back does the work. Our focus here is to try to lift from the shoulder blades up without putting pressure into our hands as he's coming up. Now notice he's not tucking his chin. He's just lifting up. He's about here 2 to 4 seconds, and then he's going to drop right back down. Okay, so our goal is not to crank the neck. Our goal is to lift from our shoulder blades up off the ground as he's leaving pressure off of his hands, and he's curling up and then right back down. Again, when we maintain control of our mid spine up, not our lower back, now we're gaining the traction that we need to create communication and stabilization pathways for our spine. So again, we're trying to mobilize every single part of our area of our spine, and we're trying to get more movement from our thoracic spine. Okay, try to get it from your shoulder blades up, 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 up. There it is, perfect. And then right back down. Repeat that about 8 to 10 times, 8 to 15 times, and then you're going to switch legs for your second set. Aim for 4 sets in doing this, so that way we have both hips extended out. Okay, so from that, we're going to do our last exercise that we have here for today. Again, there's a lot of exercises that you guys can do for lower back. Our main focus is just try to protect the area and create proper communication or mobilization pathways to the brain and let the brain know that it's okay to move in these areas. Next one we're going to do is, remember, back pain is normally the symptom, whereas the pain really is being caused by lack of control from elsewhere in the body. And so one of the things that he's going to do now is he's going to try to get his hips to work with his back muscles. And then simply put, we're going to try to go ahead and bend that left knee. We're going to take our hands out of our lower back here, and we're going to try to create some strengthening pathways for his glutes. So all I'm going to have you do here is just lift your hips up. Pull your hips up. Now, one of the biggest questions that I ask my patients is, where do you feel this? Do you feel this in your hamstrings? Do you feel this in your lower back? Do you feel this in your butt muscles? Where do you feel that?
I feel it in my butt muscles.
Feel it in his butt. He feels it in his butt muscles. Now, if he didn't feel it in his butt muscles and he started feeling it more in his hamstrings, there's a couple things that we could do. Is we could give the body some feedback. And feedback means that we can just put a band around our knees that can push our knees in as he pushes back out. So go ahead and push back out. So my hands are going to act like a resistant band around his knees, and he can push up, and then that will immediately start firing your glute muscles. Now, ultimately, you can go ahead and relax real quick. Ultimately, you want to take away that band and be able to have the butt muscles do what it needs to do, which is extend the hip. So that way it allows the lower back to do what it needs to do, which is stabilize the spine. Now, in a lot of cases, some people do feel it in their lower back when they do that position. Once again, you could put a band around your knees, and if that doesn't work, another thing that you could do is place your hands up into the air, both hands up. And you could get another band and you could place it around your hands here. And again, it's another feedback loop. Pull your hands away from each other. Now go ahead and squeeze your butt muscles and lift up. And a lot of time, this takes away the control of the lower back to do what it needs, or to work for the hips. What we want is we want the glutes to be doing the work here to stabilize as we bring our hips up into the air. Cool, go ahead and relax. Awesome. Thanks again for joining us, you guys. Today, we were focusing on back pain, and the main idea, the main goal is to create communication between your back muscles and your brain. Most people just work on stretching the back. That's not what we did here. Today, we focused on activation as well. A little bit of stretching, some communication. When I say activation, it's all about that communication pathway between the brain and the body. And when we can do that, our back pain can actually start to decrease, and we can start creating more awareness of our movement patterns when we have that control. Okay? If you really like what we're doing and you guys want to see more, hit subscribe first. Let us know in the comment section of what you guys want to see, what you guys want to learn. We're here for you guys. We want to give you guys as much education as possible, and we want to make sure that you guys move better. Thanks again, you guys, and we got your back.